So now the dietary part. So after I've really gotten used to the half and half formula that what I tag half and half. So I proceeded to do what people call 1 meal a day plan. It's a form of intermittent fasting. So like I abstain from eating for maybe like 16, 18 hours. Then I take just 1 meal a day. But I did not restrict fluid. I take fluid. Initially, I don't think I did not restrict fruits, though I was very careful on the type of fruits. Usually, I take garden egg, cucumber, watermelon, and carrots. I was kind of scared of anything that can elevate my blood sugar again. So for me, that test I did was what really got me started. And as I keep doing this, I looked at myself and I feel so good. That, wow, so I can achieve this. And in fact, my clothes size that had increased to around 42, 44, from I was like 7 years ago, like 39. That was my trouser size. So there was this particular trouser, I just like it. So I kept it. That was 39 size. Just hoping that one day I'll be able to wear it again. So I bought it when I just had my second, maybe my first child. So it was way over 7 years. So recently I just took that and I just put it on and it fits. So I was like, wow. So I've achieved this much. So I was so happy about it. So that keeps kind of motivating me. And another thing I noticed generally is that my energy level increased. I just see myself, like feeling stronger, feeling elder, despite the fact that I have to juggle a lot of things, do a lot of things together. I have the strength to do it. So it keeps me going that this definitely uh, is the way to live. So I would say uh, now after I've done the intermittent fasting for some time, I reverted back to the half and half, which I'm still on now. So I reverted back to half and half this month. I started back this November. So like kind of just to maintain, I don't want to lose more weight. I just want to maintain what the weights I've achieved. So personally, that is what I'm on. I'm still on that medication that's, has weight gain as its side effect, but I've been able to maintain my weight without, having to like maybe stop that medication or anything. So I would say talking about losing weight, achieving a healthy lifestyle, there's no quick fix, so to say. You really need to be consistent. It's not a sprint run. It's like a marathon that you have to run with determination. Just keep going, and once you see the results you're getting, that keeps you motivated. You feel so good and wow, this is me. I can be this healthy. And as another little testimony is that in the last 1 year, I've not used anti-malaria, unlike what my state of health used to be. So I see this very, very helpful. And I hope this my little story has motivated someone and given someone maybe the little push that you need. to start considering lifestyle modification. So I'm going to pause here for comments and questions. I'm going to hand over back to Aramide. So Aramide, over to you.
Wow. Thank you so much, Dr. Bola.
Okay.
That's a good story. Interesting. So you used to be the leper. Story where Aura was telling us that she has never been leper. Okay, so from leper now you became what?
Like bloated.
Well, not, and that's what you also mentioned. It's not so much about, as you said, it's so important not to, that this time, we don't want to shame or body shame or fat shame,
Yeah.
but let us know the health implications and that when we set our minds to do something, we can actually achieve it. I think you have really been able to show us this and with your story. Thank you so much. I am very, very encouraged. I would like us, if you have questions for the people in the audience, you have questions, we can, indicate by raising our hands, or you can even type in the chat box so that Dr. Bola can answer our questions. I think I sent her a personal one. I don't know if she has looked at that. Okay. So you can see that for her, she has been someone that has always been on the slimmer side, but in the process, as one of the as we grow older or whichever, we think certain that we have to events in life and life happens. I think that we have to deal with that make us have to sometimes give us some challenges. And you can see how lifestyle helps us to cope with the challenge. Sometimes maybe, look at it now, you're on a medication or something that you need to take, and you're seeing the effect. And somebody was talking the other day that sometimes that maybe you take a particular medication, it causes acne, take another medication for the acne, and now what causes this and that. And you realize that sometimes when you have some medications that you need to be on, lifestyle changes might be even an answer to it before going for other medications, right? And that's very one something that really you need to hold on to there. Okay. So if you have questions, I'd like us to ask them. There's so many ways you can deal with this. You see lifestyle changes, and being able to forward to that. You talk about. I have a question. Let me start with that. The intermittent fasting plan.
Okay.
I've heard about it quite a lot,
Yeah.
And I remember then that we used to, initially, the person would say, breakfast is the most important meal of the day. Everybody should have breakfast. It's reserved for just children or what. But I know that mom would insist, if I go to school, and mom would insist I must have my breakfast before I go. But after a while, I can't be getting into university. Breakfast was not, I'm working for lecturers. I cannot sit down and start. I don't get to eat until at 12 noon. And right now, again, it's something that I'm trying, even at this point in time, I don't always take breakfast. And the first time I try to shift back to the breakfast mode, so I like to talk about intermittent fasting. We should do intermittent fasting. What type of intermittent fasting? Must we do intermittent fasting? What about just our regular portion control? Okay, so that's one question. Then another question, the other question, see, let us just have them in. Oh yes, there's some questions that are coming.
Okay.
Somebody knows here to say, thank you, Dr. Bola. This is Bola already. It's so encouraged to hear your testimony. When you are doing intermittent fasting, does it give you some sort of ulcer pain? Another intermittent fasting question.
Yeah.
I have tried at all, but had to stop when I go to cause another problem. Then, when we are praying a daily way, also says, thank you, Dr. Bola, for your inspiring story. How much weight did you lose, and what is the recommended BMI?
Yeah. Okay. Oh, thanks for those questions. So let me start with my sister's question. Dr. Folashade Oloyede. Happy to see you here after so long a time. Um, when I started intermittent fasting, maybe because I've already reduced my calories, I did not just jump from my usual to intermittent fasting. I had started the half and half, what I call half and half. So I was like eating 3 times a day, but half is vegetable and half is my food. So that was what I started with. So it was really a gradual uh, process for me. And I think if anyone wants to really seriously consider losing weight, you shouldn't start and just from your usual and jump straight to intermittent fasting. That could really, you know, um, cause a lot of problems. So I had started with this half and half, half vegetable, half food, which I maintained. And I minimize meat. Yes, I eat, not like I have restriction, but I minimize egg like twice in a week, meat like just occasionally, more of maybe like beans. I eat this soya a lot, what they call tofu. So I eat that. So that's what I started with went, before I moved to intermittent fasting. And when I started, I discovered that even in the morning, I will not feel hungry until around maybe 12. But my intermittent fasting is kind of modified because I eat garden egg. So anytime I feel like eating anything, whatever, I just take garden egg or cucumber or watermelon. So I just alternate those fruits. So I go to work with them instead of carrying lunch. So that will be, so I do that. So it's mine is kind of modified and I did not restrict fluid. I take fluid like PRN. So I think if that didn't work for you, if intermittent fasting didn't work for you, please, you can try the half and half late. I think that will go a long way to help you reduce weight. Yeah. So someone asked how much weight I lost. I told us my weight shoots up to 64 kg. Yeah. Presently now, I'm able to maintain 56, 57, which I'm okay with. Calculating my BMI with that, I fall just within normal BMI. So I just want to keep that 57. So for me, once I cross 62, I'm already like overweight for my, because I'm very short. I'm not tall. So that makes the weight I made to gain to really be the gap to be very narrow. So that is what I achieved. But what I noticed more was my abdominal fat is what I lost. That was something that was more drastic. Like a trouser, someone who has started wearing 42, 40, at times 44, there was a time I had to buy 44 from my usual 39. That's really a lot. And it's because of my big tummy. So recently, I just discovered that I was able to wear my 39 petite size again, you know, UK 39. So I just put it on. A thought I've been thinking of, maybe will I give this one out? I like that trouser so much. So I was like, how am I going to give this one to out? I've dashed people my blazers, my jackets, everything is not just, I want to dress up for work. I wear this one straight away because it's not fitting. Now I can wear my clothes. I can, makes me happy. I feel good about myself. So I just want to keep that 56, 57, just between that.
Okay.
Someone said, okay, that's Aramide. That is the secret I'm looking for. Honestly, I just want you to try half and half, try just sustain exercise. I think it will work for you because it worked for me.
Interesting. Thank you so much, Dr. Bola. I also see here, Ora says, what was that? That she has also tried various forms of intermittent fasting, various forms. Do you know anything about the different forms? And that it has